Cancer, a word that evokes fear and uncertainty, is a complex group of diseases characterized by the uncontrolled growth and spread of abnormal cells. These cells, once ordinary components of our tissues and organs, undergo a transformation, multiplying rapidly and invading surrounding areas. This uncontrolled growth can lead to the formation of tumors, masses of abnormal cells that disrupt the normal functioning of the body. The impact of cancer extends far beyond the individual, affecting families, communities, and healthcare systems worldwide. It is a leading cause of death globally, accounting for millions of deaths each year. The World Health Organization estimates that nearly 10 million people died from cancer in 2020 alone. Despite the challenges posed by cancer, advances in medical research and technology have led to significant improvements in diagnosis, treatment, and survival rates. Understanding cancer, its causes, symptoms, and treatment options is crucial for early detection, effective management, and improved outcomes. By increasing awareness, promoting prevention strategies, and supporting research efforts, we can collectively work towards a future where cancer is no longer a life-threatening disease. Cancer can manifest in various ways, often mimicking symptoms of other less serious conditions. This makes early detection challenging but crucial for successful treatment. While this is not an exhaustive list, being aware of potential warning signs can empower individuals to seek medical attention promptly. One common symptom is unexplained weight loss. A significant drop in weight without changes in diet or exercise routine can be an early indicator of several cancers, including those affecting the pancreas, stomach, or esophagus. Another red flag is persistent fatigue. While fatigue can be attributed to various factors, cancer-related fatigue is often severe and doesn't improve with rest. This type of fatigue can be a symptom of leukemia, lymphoma, or other cancers that affect blood cell production. Changes in bowel or bladder habits, such as persistent diarrhea or constipation, blood in the stool, or frequent urination, especially at night, can be signs of colorectal, bladder, or prostate cancer. It's important to remember that experiencing these symptoms doesn't necessarily mean you have cancer. However, it's crucial to consult a healthcare professional for a proper diagnosis and to rule out any serious medical conditions. Early detection is key to improving cancer outcomes. While it's impossible to eliminate the risk of cancer entirely, adopting a healthy lifestyle can significantly reduce your chances of developing this disease. Making conscious choices about what you eat, how active you are, and how you protect yourself from harmful substances can make a world of difference. One of the most impactful lifestyle modifications is quitting smoking. Tobacco use is linked to various cancers, including lung, mouth, throat, bladder, and kidney cancer. Quitting smoking, regardless of how long you've smoked, can dramatically reduce your cancer risk. Maintaining a healthy weight is another crucial factor. Obesity increases the risk of developing several types of cancer, including breast, colon, and endometrial cancer. A balanced diet rich in fruits, vegetables, and whole grains, combined with regular physical activity, can help you achieve and maintain a healthy weight. Protecting yourself from excessive sun exposure is vital in preventing skin cancer, the most common type of cancer in the United States. Using sunscreen with an SPF of 30 or higher, wearing protective clothing, and seeking shade during peak sun hours can significantly reduce your risk. Remember, small changes in your daily routine can have a significant impact on your long-term health. By adopting a healthy lifestyle, you're not only reducing your cancer risk, but also improving your overall well-being. Early detection plays a pivotal role in the successful treatment of cancer. When cancer is detected early, before it has had a chance to spread, treatment is more likely to be effective. Regular screenings and self-exams are crucial components of early detection. Screenings are tests that look for cancer before any symptoms appear. They are particularly important for people at high risk, such as those with a family history of cancer or those who have been exposed to certain risk factors. Common cancer screenings include mammograms for breast cancer, colonoscopies for colorectal cancer, and Pap tests for cervical cancer. Self-exams involve regularly checking your body for any unusual changes, such as new moles, lumps, or sores. For example, women should perform monthly breast self-exams to check for any lumps or changes in breast tissue. Men should regularly examine their testicles for any lumps or swelling. Early detection empowers individuals to take charge of their health and seek timely medical intervention. By staying informed about recommended screenings and performing regular self-exams, you can increase your chances of detecting cancer early when treatment is most effective. Cancer treatment is not a one-size-fits-all approach. It requires a personalized plan tailored to the specific type, stage, and location of the cancer, as well as the individual's overall health and preferences. A multidisciplinary team of healthcare professionals works together to develop and implement the most effective treatment strategy. This team often includes oncologists, surgeons, radiation oncologists, nurses, social workers, and other specialists who provide comprehensive care throughout the treatment journey. They work collaboratively to address not only the physical aspects of cancer, but also the emotional, social, and financial challenges that patients and their families may face. The choice of treatment depends on various factors, including the type and stage of cancer, the patient's overall health, and their personal preferences. Treatment options may include surgery, radiation therapy, chemotherapy, immunotherapy, targeted therapy, or a combination of these approaches. Navigating the complexities of cancer treatment can be overwhelming, but understanding the different treatment options and working closely with your healthcare team can empower you to make informed decisions about your care. Surgery, one of the oldest forms of cancer treatment, involves the removal of the cancerous tumor and surrounding tissues. It is often the primary treatment for early-stage cancers that are localized to a specific area of the body. The goal of surgery is to remove as much of the cancer as possible while preserving as much healthy tissue as possible. The extent of surgery depends on factors such as the size and location of the tumor, whether it has spread to nearby lymph nodes, and the patient's overall health. Surgical techniques have advanced significantly in recent years, with the development of minimally invasive procedures that use smaller incisions and specialized instruments. These advancements often result in less pain, fewer complications, and faster recovery times compared to traditional open surgery. Surgery can be an effective treatment for many types of cancer, but it is not without risks. Potential complications can include infection, bleeding, and damage to surrounding tissues. It's important to discuss the potential benefits and risks of surgery with your doctor to determine if it is the right treatment option for you. Radiation therapy utilizes high-energy rays to destroy cancer cells or prevent them from multiplying. This treatment modality plays a crucial role in the management of various cancers, either alone or in conjunction with other therapies like surgery or chemotherapy. Radiation therapy works by damaging the DNA of cancer cells, hindering their ability to grow and divide. This targeted approach aims to minimize damage to surrounding healthy tissues while effectively targeting the cancerous cells. The delivery of radiation therapy can vary depending on the type and location of the cancer. External beam radiation therapy uses a machine outside the body to direct radiation beams at the tumor, while internal radiation therapy involves placing radioactive materials directly inside the body, near the cancer cells. Radiation therapy, like any cancer treatment, comes with potential side effects. These side effects depend on the location and dosage of radiation and can include fatigue, skin irritation, and hair loss in the treated area. However, most side effects are temporary and subside after treatment is completed. Chemotherapy, often referred to as chemo, utilizes powerful drugs to kill cancer cells throughout the body. Unlike surgery or radiation therapy, which target specific areas, chemotherapy is a systemic treatment that travels through the bloodstream, reaching cancer cells that may have spread beyond the original tumor site. Chemotherapy drugs work by interfering with the ability of cancer cells to grow and divide. Different chemotherapy drugs work in different ways, and often a combination of drugs is used to maximize their effectiveness and minimize drug resistance. Chemotherapy is typically administered intravenously, but it can also be given orally as an injection or directly into the affected area. The treatment schedule varies depending on the type of cancer, the drugs used, and the patient's overall health. Chemotherapy can be highly effective in treating many types of cancer, but it often comes with significant side effects. These side effects vary depending on the specific drugs used and the individual's sensitivity to the medication. Common side effects include nausea, vomiting, hair loss, fatigue, and an increased risk of infections. Immunotherapy, a revolutionary approach to cancer treatment, harnesses the power of the body's own immune system to fight cancer cells. By stimulating the immune system, immunotherapy helps the body recognize and destroy cancer cells more effectively. Our immune system is a complex network of cells and proteins that work together to protect the body from foreign invaders, such as bacteria, viruses, and even cancer cells. However, cancer cells can sometimes evade the immune system's defenses, allowing them to grow and spread unchecked. Immunotherapy works by either boosting the overall activity of the immune system or by training it to specifically target cancer cells. Different types of immunotherapy work in different ways, and researchers are continually developing new and innovative immunotherapies. Immunotherapy has shown remarkable promise in treating a variety of cancers, including melanoma, lung cancer, and lymphoma. It offers a new paradigm in cancer treatment with the potential for long-lasting remissions and improved survival rates. Targeted therapy is a type of cancer treatment that focuses on specific molecules involved in the growth, progression, and spread of cancer cells. Unlike chemotherapy, which targets all rapidly dividing cells, targeted therapies are designed to interfere with specific pathways that are essential for the survival of cancer cells. These therapies work by blocking the action of proteins that control cancer cell growth, preventing the formation of new blood vessels that tumors need to grow, or delivering toxic substances directly to cancer cells, sparing healthy cells. Targeted therapies are often used in combination with other cancer treatments, such as surgery, radiation therapy, or chemotherapy, to enhance their effectiveness. The choice of targeted therapy depends on the specific type of cancer and the molecular profile of the tumor. Targeted therapies have revolutionized the treatment of certain types of cancer, leading to improved outcomes and fewer side effects compared to traditional chemotherapy. However, not all cancers have targetable mutations, and resistance to targeted therapies can develop over time. A cancer diagnosis can be life-altering, affecting not only the individual's physical health, but also their emotional, social, and financial well-being. Coping with the challenges of cancer requires a holistic approach that addresses the multifaceted needs of patients and their loved ones. Support groups provide a safe and supportive environment for individuals with cancer and their families to connect with others who understand what they are going through. Sharing experiences, exchanging information, and providing emotional support can be invaluable during this challenging time. Palliative care focuses on improving the quality of life for people with serious illnesses, including cancer. It involves managing pain and symptoms, providing emotional and spiritual support, and coordinating care to ensure the patient's comfort and well-being. Financial assistance programs can help alleviate the financial burden that often accompanies cancer treatment. These programs provide grants, loans, and other forms of financial aid to eligible patients to cover medical expenses, transportation costs, and other related expenses. In the face of cancer, knowledge is power. By understanding the disease, recognizing the symptoms, and making informed choices about our health, we can empower ourselves and our loved ones to take charge of our well-being. Cancer awareness is not just about knowing the facts, it's about taking action. It's about making healthy lifestyle choices, getting regular screenings, and advocating for ourselves and our communities. Supporting cancer research is crucial for developing new and innovative treatments, improving early detection methods, and ultimately finding a cure. By supporting organizations dedicated to cancer research, we contribute to a future where cancer is no longer a life-threatening disease. Let us stand together, united in our commitment to raising awareness, promoting prevention, and supporting those affected by cancer. Together, we can make a difference.